Getting started, you will need 2 blocks, a strap, and either just your water bottle is fine or a lightweight, about 3 pounds. Benefits and contraindications. Inversions have a lot of health benefits, like improving your circulation, your blood pressure, and reversing some of the effects that gravity has on you. It also helps move fluids that tend to pool in one direction. However, handstanding might not be for you. It's not for everybody, and it really depends on your particular body and what's going on with it. This is something that you definitely will want to talk to your healthcare provider about. There are other gentle ways to invert where you can reap those benefits just as well, like legs up the wall and maybe putting a block or bolster under your hips. So if you have any questions or concerns, make sure that you talk about this with your healthcare provider and make sure that handstanding is right for you. Breathing upside down. This can be very difficult at first with a lot of pressure in the head. It takes getting used to. You have to condition the body to breathe in that direction just the way that you condition the lungs to go for long runs. However, there could be a serious health reason why it's not feeling right for you, like high blood pressure or circulation issues. If this is a possibility and you have any concerns, please talk to your healthcare provider and make sure that handstanding is okay. If there are no health or medical complications, then typically with consistent practice, even just bending over backwards on a couch like a child might do, then you should get more used to breathing upside down in about 2 weeks. If possible, I do encourage you to breathe in and out of the nose, up and down the back of the throat in nice, controlled, balanced breaths, stroking the back of the throat, similar to how we breathe in our practice with Ujjayi breath, but a nice, subtle version, nothing too audible. Of course, this can be really difficult as you're handstanding, and breathing at all is more important than getting that perfect Ujjayi breath. So just make sure that you keep breathing, especially in the difficult parts where we tend to clench and hold. That's where you're going to need your breath the most. Gaze. Gaze is so important for our balance and our stability. We've been walking a really long time, but if you close your eyes and start to walk, it changes the game. We will talk a lot about stacking the joints and the distribution of weight so that we can hold the body in a nice controlled position. The head weighs a lot, but we want to choose a position when we're starting out that doesn't compromise our close, fixed gaze. The other thing that we don't want to do with our gaze is look too far forward, because then we start working against the stacking of the joints. We start to bend the neck and bend the cervical spine. This reverberates throughout the entire alignment of the body. So our gaze position at first is pretty important. We have to find that balance of having a gaze point that is efficient, but not looking too far forward so that we're starting to bend too much in the joints, but not dropping the head so much to seek that alignment that we sacrifice our close, fixed gaze. So I suggest when you're learning to handstand or you're just seeking a neutral handstand position to have a gaze point that's somewhere between your pointer finger and your thumb. And I like to imagine that if you drew a line from one pointer finger to the opposite thumb and another from the other pointer finger to the opposite thumb, making an X, that cross, that point where the X crosses, is a great place for a neutral gaze position. This is going to be a little different for everybody because we are all a little different. So find what works right and feels right for you without compromising the stacking of the joints too much by looking too far forward or dropping the head too much and sacrificing that nice, close, fixed gaze position. Hand position. Again, this is going to look a little different for everybody because we are all built a little different. But a good general rule of thumb is that your hands should be shoulder width apart. Wrists below, elbows below shoulders. Then I think it matters a little less where your fingers are pointing and a little more where the crease in your wrist is facing. We want the crease in the wrist to be straight, aligned forward with the front of the mat. So face the crease forward, and wherever those fingertips lie, it's probably okay. Pressure points. Where we want to distribute the weight as we whole body weight bear down on our hands and our wrists. This is very important to avoid wrist pain and prevent injury. Think of your fingertips like your controllers, like you're playing a game, and the game is to keep the whole body upright and balanced while it is constantly micro-moving. These little guys have a lot of power in them. They can correct or even prevent a fall, and they are constantly managing this micro movement, this balance. Moving down from the fingertips, the controllers, we come to the knuckles, the first knuckles. And these guys we want to have a lot of buoyancy in so that the fingertips do have the ability to move around and do their job. The next set of knuckles is a higher pressure point zone, especially towards the edges of the hand. The thumb knuckle pad, that's our sweet spot. We want to distribute a lot of pressure and weight here. However, it is right next to the heel of the hand. And this is where we want minimal pressure. It is a pressure point. It will be touching the mat. Unlike the center of the hand where there is zero pressure. But we want minimum pressure at the heel of the hand. So move it over here to the thumb pad. And this is why. The more pressure you have on the heel of the hand, the more impingement there is at the wrist. Now think about the carpal tunnel here where nerves and circulation flows, and visualize it as an actual tunnel. The more pressure you put at the wrist, the more closed off this tunnel is. This is going to appear in the form of pain, and it's impingement to all those nerves, that circulation that runs through. Now, if you're already experiencing wrist pain in positions like plank, where your wrist is at a 90-degree angle, tune in to the upside down anatomy on hands and wrists, and we'll go over some of that there. Bandhas. Bandha is a lock or a hold, so you can see how this would be pretty critical for a handstand where we're trying to lock and hold in a whole body posture. Accessing all of the bandhas is always very important and helpful when attempting advanced postures. But specifically for the handstand, we really want to access the Uddiyana Bandha, or the upward lock of the abdomen. There is a difference between flexing and accessing the bandhas. Flexing you can think of more as a contraction or solidifying or expanding a certain area. And especially with the Uddiyana Bandha, this is more of a suction lock. It draws the contents of the belly upward, creating an abdominal cavity and that belly to spine lock. Be patient with this. It does take a lot of time and practice before it becomes second nature. You can practice in positions like downward facing dog and just think, inhale, suction, lower abdominals back towards the spine. Exhale, belly button to spine and tuck the ribs. And you can practice this in a pranayama technique as well that I'll show you really quickly. Placing your hands on your quads. We're going to exhale all of our air out and let our abdominals go. Let the gut just kind of spill forward. Now on our inhale, we're going to inhale through the lower abdominals. So we're not actually going to take the air in through the nose or the mouth. And you're going to create that suctioning of the lower abdominal contents up towards the rib cage and belly button to spine. If you have either of my handstand books, the Book of Handstands or Upside Down workshops, this is a great time to look through the first few sections on gaze, hand positioning, breathing, bandhas, and see if all of that makes a little bit more sense now.